that has spread around the world and that we are still dealing with. A couple of things I wanted to take a look at. The first one, I wanted to talk about Japan. Um, Japan has seen quite an increase in the number of people with the virus, people that are being infected. It's not looking very good right now, but let me share that with you very quickly here. Um, hmm? Oh, yeah. So this is the data. Let me put myself up in the corner here. There we go. All right, so this is some recent data that we have here. Um, I haven't got it where I can show it very clearly, I guess. Sorry about that. I'm going to have to rearrange this. Let's see. Maybe what happened then? Okay. It still doesn't help, does it? Don't quite have this figured out as far as sharing the graphics, but anyway, what I wanted to show you here is that Japan is surging. You can see this daily new cases. We are reaching a new high. Um, if you can see the number, you can't see the numbers here, but 7,629 on let's see, this was I think 2 days ago, and then yesterday it was up to 10,699. It's been modified to 10,745. Yeah, this is looking pretty bad. Maybe there that so as we look here at this, you can see, so we've had waves come through Japan. The first wave last year, the second wave last year, and then the year end, everyone expected it. One, it was winter. Two, everybody traveled going home for the holidays and so on. The year end is very big here, of course. It went up pretty steeply, came back down also very steeply, but then followed up rather quickly during what we call our Golden Week holiday. Reached a new high there. Okay, going up at different times, even more steeply um, than the previous one, and now we've got this new wave that's hitting us. That could be the worst yet. The Delta variant is nothing to sneeze at, right? Right. You can see here, right, this is the daily new cases going up and down and up and down. And here, as you can see, this is the highest point, the highest number of single day cases during the entire pandemic. And that was yesterday, I believe. We've had, as far as I think we've had record-setting number of cases for the last 3 days consecutively. 3 or 4 days ago, it broke the record previously held, and then the next day there were more, and the next day more again. So it's not looking good. It's just not looking good at all. There are about 25% of the population is fully vaccinated. Um, I believe approximately a third of the population has at least one vaccine shot injection. But it's not enough. Tokyo, you can see over 3,000 just in the Tokyo area alone in one day, new cases. In the area where I am, Kumamoto, population of about 1,000,000, 91 new cases in one day. Um, not the highest we've ever seen, but again, we are far separated from Tokyo. It takes a while for the wave to propagate itself to our area, and I do expect that that's what's going to happen. So that's what's happening in uh, around here right now. Um, not so good news. But then I was looking at something from the CDC. This is from Voice of America. Let me just read a little bit to you. But the way they word it, it's a little bit misleading, perhaps. So let me read it. The U.S. Centers for Disease Control and Prevention says the Delta variant of the coronavirus is as contagious as chickenpox, and that infections in vaccinated people may be as transmissible as in the unvaccinated. Internal CDC documents, first obtained by the Washington Post, urge staff to acknowledge the war has changed in light of the Delta variant. The CDC said the variant requires a new approach to help the public understand the danger, adding that evidence shows the Delta variant may pose a greater risk for hospitalization and death. The agency also emphasized that vaccines are highly effective at preventing infections, severe disease, and death. Okay, let me read that again. The agency also emphasized that vaccines are highly effective at preventing infections, severe disease, and death. CDC said that while the vaccinated are less likely to get sick, they might be just as likely as those who are unvaccinated to pass the disease to others. Okay. Now, the way I understand it, and it's not written clearly here, um, so the vaccines that we are currently getting, be they Pfizer, Moderna, Johnson and Johnson, or whatever, are less effective in preventing uh, being infected with the Delta variant as opposed to the earlier Alpha variant or the original virus that came out, right? Um, but they are still very effective. 80%, around 80%. There are lots of numbers. It depends on the study and so on. But let's say a ballpark of 80%. That's highly effective. I think that's more effective than the standard flu shots that that people get every year. So the people that are not infected, right? People that have gotten the vaccination, even if they're exposed to the virus, chances are good that they will not become infected with the virus. Now, those people are not going to pass on the virus. They're not infected with it. They're not going to pass it on. But that those other percentage, the 20%, 15, 20%, 25%, depending on the study that you look at, that even though they are fully vaccinated and they won't get very sick, they probably the great likelihood is that they will not get very sick, they will not end up in the hospital, and it's highly unlikely that they would die from the disease if they get it. But this is now saying that they can pass on the virus to others to the same extent that people who are unvaccinated spread the disease, pass on the disease. Now that seems counterintuitive. It seems to me that, I mean, I would think that the severity of the illness is going to be less in the people that are vaccinated, and it would seem to me that that should be related to the viral load, as they talk about, less of the virus in the body, so people are not getting as sick. But maybe that is not the case because they're saying that people people might be, let me say that again, they might be just as likely as those who are unvaccinated to pass the disease to others. Okay, so might be. We don't know yet, right? But if they are infected, whether they've been vaccinated or not, right? Even those vaccinated, there is a 1 in 5 to a 1 in 5 to 1 in 10 chance of being infected again if exposed. Okay, if they are infected, they themselves will very likely have a mild case of the disease, a mild case of the COVID-19, but they might pass it on to others. So even people that are vaccinated should be wearing masks, should be social distancing, should be ventilating the area, should be sure that they are in ventilated areas, right? Okay. Now, it's always been my understanding that outdoors, it's less necessary or maybe even unnecessary for people to wear masks unless they are in very close proximity. I mean, ventilation, you can't get any better ventilated than being outdoors, right? You've got a lot of fresh air moving through all the time, right? So unless you are in very close proximity to a number of people, probably masking outdoors is not necessary. But as soon as you go indoors, even if you're on a bus, I've noticed that buses sometimes do and sometimes don't have their windows open, and I don't quite understand that. I know that it's hot. I know that they want to run the air conditioner, but uh, the buses would be relatively safe, I feel, if people are careful of the occupancy. They space themselves out within the bus, and if the bus windows are open, you're going to get a lot of ventilation as the bus moves. Air pours through the window. It's going to keep the viral load down. It's not going to eliminate a virus from someone who's infected and riding the bus, but that virus will not accumulate inside the bus. I have ridden the bus a couple of times since the pandemic started, and when I got on the bus, uh, both times I remember windows were not open or only a few were open, a tiny crack, and I went in and I opened up at least 2 or 3 windows as far as I could. It's just ridiculous not to have the windows open, in my opinion. But anyway, top U.S. infectious disease expert Dr. Anthony Fauci said during an interview Friday with Reuters that he hopes regulators will grant full approval for COVID-19 vaccines as soon as next month. Let me comment on this. Yeah, I it's still under emergency authorization, right? If you want to instill confidence in the population that the vaccines are safe and effective, well, give them full approval. It's rather ridiculous after millions, tens of millions of people being vaccinated that they still have not given full approval. It doesn't make sense at all. To me, it doesn't make sense. It must make sense to somebody, But I don't understand it. He said the move could encourage more Americans to get the shots. Yeah, what I just said, which are currently authorized on an emergency use basis by the U.S. Food and Drug Administration. Right. Yeah. All the things that I just said. Emergency use, that's not going to instill confidence in these people that are, for whatever their reasons are hesitant. Give it full approval. I think it's earned it. Give the vaccines the full approval. Then you've got a little bit stronger argument, at least in when you're encouraging people to get the vaccines. U.S. President Joe Biden announced Thursday that civilian federal government employees must be vaccinated or submit to regular testing and wear masks. Yeah, there's a lot of talk about this. I understand. Civilian federal government employees must be vaccinated or submit to regular testing and wear masks. That seems to me maybe less than comfortable, but it seems to me a good thing, the right thing to do. I support that. Lead by example. Federal employees, get vaccinated. You're working for the government. The government policy is to get vaccinated, so get vaccinated. I understand that people have concerns, legitimate concerns, right? There are people that have reactions, but again, and many people have said it in more succinctly and clearly than I have, but the benefits outweigh the risks, and that's the most reasonable way to make a judgment about the best course of action. The benefits outweigh the risks, therefore you do the action, right? Get the vaccine. It's better than getting sick. It's better. It's and the likelihood of the reactions are very small, not zero. Everybody admits to that. They're not zero, but if you have a bad reaction to the vaccine, you're probably going to have a bad time with the virus also. I mean, remember, the vaccine is mimicking the virus in certain aspects. And if something mimicking the virus gives you a hard time, the actual virus is probably more likely to give you a hard time, right? So anyway, Walmart joined a growing number of U.S. companies Friday to issue employee mandates for its workers to be vaccinated, saying the policy would apply to all employees at its headquarters, along with managers who travel within the United States. Okay, so Walmart is joining in. Get vaccinated. I support them. Walmart's not my favorite store, but I think this is a good policy. I don't quite understand. Walmart joined a growing number of U.S. companies Friday to issue employee mandates for its workers to be vaccinated. For a portion of its workers to be vaccinated, it sounds like, saying the policy would apply to all employees at its headquarters. All employees at its headquarters. I don't like the way they wrote that. I mean, it leads you up to think that Walmart is requiring the vaccination, all their employees to be vaccinated, and then you find out it's the employees at its headquarters and managers who travel. Okay. So the headquarters, I'm assuming they only have one headquarters, so one location, all the people are going to be required to be vaccinated. Kind of a halfway measure. I guess, perhaps there are state laws and things like that are involved in the different locations, Walmart being a nationwide chain and so on. I don't know, but that seems, as I read to the end of the paragraph, it seemed that it got weaker and weaker. mandate for its workers to be vaccinated, but that's at its headquarters and managers who travel. All right. And the Broadway League said Friday that audiences will be required to show proof of vaccination to watch Broadway performances and will be required to wear masks. Okay. I like that too. If you're watching a Broadway musical, if you're watching a Broadway performance, you're inside. You're at an indoor venue. It may be a large theater, but it's still an inside venue, and there are going to be a large number of people there. Let's see proof of vaccination. That's not enough. Remember what I was talking about before? Even people that have been vaccinated can be carriers, right? They can get the disease, a certain number of them, right? A portion of them. So if you've got a Broadway performance with 1,000 audience, right? Even if they're all vaccinated, the chances are that as many as 200 of them, even though they're vaccinated, could be infected with COVID, the Delta variant, could be spreading it to others, right? So anyway, it just makes sense to me. In worldwide developments, Philippines President Rodrigo Duterte announced lockdown measures Friday for the Manila capital region, home to 13 million people. The move is designed to curb the spread of the Delta variant of the coronavirus. The lockdown will go into effect beginning August 6th and last until August 20th. Okay, so Duterte, I believe myself that he has the best interests of the Philippine people. That he has the best intentions of the best intentions toward the Philippine people, and lockdown, as uncomfortable and in some economically difficult and questionable as it can be, we're talking about saving lives. It seems to be the thing to do. They're giving people until August 6th to get to where they need to be. That's maybe not such a good idea, actually. If you're going to have a lockdown, you really want to lock it down from the time that you announce it. Otherwise, too many people will leave the area, and then the lockdown has very little effect. Anyway. In Japan, here we go. Japanese authorities expanded a coronavirus state of emergency to 4 areas outside Tokyo following spikes in infections in the capital as the city hosts the Olympics. Yes. Tokyo and Okinawa have already been placed under a state of emergency because of the spread of the coronavirus, right? State of emergency, back to level 5 again. It's not good. I think this is the 3rd time this year that we've been at that highest level of emergency status. Saitama, Chiba, Kanagawa, and Osaka are the new prefectures to be under the state of emergency. Several other prefectures will be placed under pre-emergency measures. I believe that Fukuoka is one of those, but I'm not sure. Fukuoka also has seen an increase, as we have in Kumamoto here, near the levels that we had during the level 5 state of emergency, the highest state of emergency. We're not at those numbers yet, but we're getting close. Under a state of emergency, business is suspended in locations that serve alcohol or have karaoke. Under pre-emergency measures, businesses are asked not to serve alcohol. Japan reported more than 10,000 daily coronavirus cases Thursday, the first time the country's daily count exceeded 10,000. All right, so we're hitting new highs here. It's not a good thing. And then there's more news around the globe, but I think you get the point. It's not looking good. It's not looking good. Let me just briefly, Israel, they're giving booster shots, coronavirus vaccine booster shots to people over 60 who have already been fully vaccinated. Now they're giving them booster shots to try and increase uh, their level of immunity. Let's see. WHO officials have said they fear that 47 of Africa's 54 countries will miss a September target of vaccinating 10% of their populations. September target of 10%, and the large majority, in fact, only 7 out of 54 will meet. It looks like they will meet the target. So that's really quite disappointing. I mean, Japan has been slow, Australia has been slow, but this is really sad. There are a lot of people that are going to get sick. This just is going to happen. Overall, around the globe, just 1.1% of people in low-income countries have received at least one vaccine dose. 1.1% of people in low-income countries have received at least one vaccine dose. So, according to Friday, yesterday, more than 197 million global COVID infections and more than 4.2 million deaths worldwide. 4.2 million deaths associated with COVID. It ain't over yet, folks. So, I guess that's all that I wanted to talk about right now. I think I will be back a little bit later, maybe in about half an hour, 45 minutes, try to get online again and see if my buddy Jeff has anything to talk about. But that's all for now. So thank you for watching, and look for me on YouTube also. I broadcast this on YouTube, and actually there are a few things on YouTube that aren't on here. This is, as you know, basically a live platform, a live broadcasting platform. I do have a few videos, some clips from vacations that I've taken and so on that are available on YouTube that are not available here. So why not check that out? You can find my YouTube channel information. You can find the link there under my profile. Please do that. Oh, there we go. Well, how does that work? It doesn't do anymore. Oh well. Anyway, yeah. So there it is. YouTube. The same link there twice. I don't know why. Anyway, that's all for today, or that's all for right now. Watch out for me. Watch out for me. Yeah, watch out for me later. Yeah. Check in later, see if I'm online again. I hope to be. Thanks again, and see you